raccoon when I was finished for the day. I had bruising under my chin and under my eyes, but other than that, Dr. Tang gave me a prescription for Painfil, and I didn't need it.
Okay.
And
Oh, I didn't tell you about that part.
yeah, no, I never took them. I shredded the prescription, and it was never really uncomfortable.
Yeah.
I just found that with the new teeth, it was difficult talking because they were thicker, I guess, to support the implant.
That's right, just for strength.
For strength, and I found when I said S's or 6, it kind of whistled, and then as the gum shrunk, there was kind of a hollow between the teeth and the gums, and so sometimes you get a whistling effect. But I never had any real discomfort other than that, and I was willing to say that was well worth what I was going to end up with in the long run, because I have a really bad gag reflex. And the worst part of the whole thing is the impressions. You know, I
Remember that part?
Yeah, I gagged a lot, but that was the worst part of it. I think for me was the gagging, and even the whole procedure on the day was not. It was a long procedure, and the worst part, my neck and my shoulders were sore from sitting with your head back.
You're gonna get a massage therapist in here.
Yes.
Yeah, the patients and the doctor, you know. I'm sure are struggling like this.
Yeah, so that was the worst of it. Was you know, I had my neck and my shoulders were sore, but I can honestly say it wasn't that painful. I didn't, you know, it wasn't that I couldn't eat. I was asked not to eat anything solid or hard for a couple of days, but you know, even after that, I think the end results when I get my permanent ones in a couple of weeks it'll be really nice.
So did you have partial dentures when you made this decision, or?
No, I had an implant before. I'd lost an eye tooth, and at the time they gave me a partial plate, and I could not talk with the partial plate. I could keep it in my mouth, I could sleep with it in, I could eat with it in, but I couldn't talk. Every time I'd talk, I'd go to gag. I'd have to slip it out and put it somewhere. I lost it more times than enough. So I realized, you know, as I got older and my teeth were kind of wearing out, that I was never going to be able to have dentures. I couldn't. I've seen my aunt, my dad, and other people with dentures, and you know, they slip and they fall out, and they're talking to you, and they're coming out of their mouth or whatever, and I just knew I couldn't do that. So this was, you know, a good alternative for me. So, and the one implant that I did have originally lasted me for like 14 years. So it wasn't, and that was many years ago. So, you know, technology's gotten so much better now, and I guess every day they're coming up with new stuff, and I'm quite happy with it. I would do it again if I had to.
It looks like you have your top teeth in?
Yes.
Oh, and the bottom as well?
Yeah.
Okay, and you said you're getting permanent ones. What are these then?
These are just temporary. These are the ones that they put in on the day that you have your surgery.
Mm-hmm.
So when you go home, you've got a set of teeth. You don't go without any teeth.
Right.
So
Did you start chewing on them right away?
I didn't really, because you told me.
Listen, that's good.
Yeah, you told me for a couple of days, just, you know, soups and soft food. But I did, after that, I didn't have it. I mean, it's not exactly like your normal teeth. And I had a bone infection that had to be cleaned up at the same time. So as a result, my teeth ended up being a little bit farther up than they probably would have been. So when I bite on something, they don't actually meet in the, you can't really bite into anything, but I should be able to when I get my permanent ones, because they'll be adjusted for that. But that was
a little bit of a preview of what it could look like there, at least what it would feel like today.
Yes.
And we're still tweaking
Yeah.
the aesthetics of it.
Yeah, for the last couple of weeks, we've been putting in the new ones or wax molds of
Wax
what the
molds,
new ones
that's
will
right,
be.
yeah.
And then they can be adjusted, and if they don't feel right, then they send them back until they do feel right.
How long a period is it before you get to the permanent teeth?
Well, I had the surgery on the 29th of November, and I should have my teeth next month, so 6 months. But it was the same when I did the original implant. Like, they take the tooth out and put the implant in, but they don't put a tooth on it. That's why they gave me the partial plate. And they don't put a tooth on it for 6 months. But I couldn't handle that. Even a partial plate, was too much.
It's not for everybody, partial things.
No, I mean, there's a lot of people that have false teeth and don't have any problem. And I had a friend that had false teeth since she was in her early 30s. But they say if you do it when you're young, then you get used to them, But when you get older and set in your ways, you're not wanting to change too many things,
I guess you don't know what it's like to have teeth at age 30 so much as you lived through an
Yes.
entire lifetime with teeth in place.
Right. But no, I'm glad that I had it done. I'm really looking
Well,
forward
good.
to getting
So far?
to the permanent stage.
Yeah, not too long. We're on the home stretch now, which is fantastic.
Yeah,
I'm
another few weeks.
excited about the kind of results we're going to get for you.
Oh, me too.
Yeah.
How costly is that procedure?
Well, usually if we're looking at a single arch in an all-on-4 procedure, it's typically on average about $25,000 per arch. So, if you're doing 2 arches, typically it's double the fee, but we'll oftentimes do something to offset some of the cost. I think one of the barriers, of course, is cost for treatment, and there's a lot of very different ways where we can try and address the cost issue. One of the nice things about our practice is that we do have a treatment coordinator, and her role is to take you by the hand and lead you through